Dr. Mingle, what do you think are the most important proposals for MIPS participants?
Well, there's lots of things going on in the proposed rules for MIPS, but most of it is the typical housekeeping, improving, changing some specifications, eliminating some measures, adding some measures, things like that. There's just two things I think warrant a little special attention. CMS proposes to increase the MIPS performance threshold to 82. That's an increase of 7 points from the 2023 threshold of 75. That's a big increase, especially considering that 82 represents average scores across the three performance years, 2017, 18, and 19. They've taken those 3 years, looked at the average, and even averaged that average over those 3 years' time. Now, those averages were generated in the first 3 years of MIPS when requirements have never been easier. More bonus points were available. Cost measures were not factored in. Uh, Scores cluster in that range of the 0 to 100 scale of scores. There's very few scores that are on the low end, a lot on the high end. So a lot of differentiation in those. There's more than a 7% difference in occurrence of those 7 points between the 75 and the new 82 proposed performance threshold. On the good side, it means that there's likely to be a higher potential incentive for those who come in above the threshold than there would have been. So judge for yourself whether you approve or disapprove of that 82. That change to 82 and make your comments appropriately. The second thing is a proposal to increase the performance period for promoting interoperability. So the PI category, they propose to make a 180-day minimum performance period. That's up from 90. So this is a big change. I don't think it should be an unpopular change. I don't think many people need to go to that shorter 90-day period. It makes it match the expectations in the hospital promoting interoperability category. And it will make a bigger difference in people who are changing electronic medical records during the year. It means a larger period of time you need to be live on your new system in order to report on it. Although I expect that part of this change means to also be a little more lenient with exceptional for performance exception applications, because you won't have as much time to get your change up and running to get a full 180-day performance period. It also seems a little unlikely that they will make another increase, since this has been the hospital requirement for a long time. So we may see them both continue indefinitely with a 180-day PI performance period.